chances are you or someone you know has food allergies. I'm Liz Edwards, and I'm joined by Dr. Gina Bush of the Allergy, Asthma, and Sinus Center today to talk more about diagnosis and treatment of food allergies. How common are food allergies in our area?
Extremely common. Among children, it's estimated that about 1 in 13 kids has a food allergy. So if you think about your kid's classroom, that means on average 2 kids out of every class will have some form of food allergy. And food allergy is not just a disease of childhood. We see adults all the time who may have kept their food allergies into adulthood, or they could have even developed new onset food allergy into adulthood. So it's extremely prevalent, and we see it quite often in clinic.
What are the symptoms of a food allergy? Classic symptoms.
So classic symptoms of a true food allergy are you ingest the food, you may immediately feel itching, maybe symptoms of congestion, runny nose. You may develop a very specific skin rash called hives, which sometimes people call whelps or flushing of the skin. Often within minutes you may have gastrointestinal symptoms such as cramping, nausea, and then that may progress on to things like vomiting or diarrhea. But and it can even become life-threatening later in the reaction. It's difficult sometimes to know the difference between a food allergy and just an adverse food reaction. Because there's a lot of different food sensitivities and things like that where people may have similar symptoms, so it can be difficult to understand the difference.
So if we're uncertain, we can come in and we can be tested for food allergies.
Yes, absolutely, and that's the best thing to do. If you're not sure what's happening to you when you eat these foods, but you know that you have symptoms, it's best to get evaluated by an allergist and get the allergy testing done and see, because sometimes, like I said, food allergy can be life-threatening, and so it's important to understand the difference.
Well, thanks so much for being with us. To learn more, you can go to the Allergy, Asthma, and Sinus Center website at allergyasc.com.